the Encourage project, just as a description, is the best way to explain it is when you go to a doctor and he's going through his normal questions, he says, "Oh, you need to lose some weight. I want you to be more physically active." But then what does he say after that? Right? Like there's nothing. There's no supports, because people that don't exercise, there's a lot of reasons why they don't have time. They don't know where to go. They get sore when they do it. And there's not much doctors can do except scold you and say, "I want you to exercise more." So the Encourage project is an acronym for the big name of our project. But it was really about encouraging people to become more active and encouraging healthcare to help people to do that. So teaching people or patients that attend clinics, how do you become more active with the support of a healthcare provider? So what we did is we created new links from the clinic to the existing neighborhood community physical activity programs. So doctors could actually say, "Well, I want you to be more active. Here's some information on a yoga program. Here's some information on the YMCA. Here's some information on the Snaps Fitness. Here's some information on the City of Winnipeg programs. Oh, you're not sure what kind of clothes to wear? Here's a referral to a program about how to be physically active for beginners." Right? And those things don't actually exist, because right now, if you go to a gym, you walk in, you look around, and there's the guy with the big protein shake and big muscles, and you're like, "Oh, I don't look like him. I don't know if I belong here." Well, in reality, you don't need to go to a gym to do this stuff. You can go to a walking group. You can go to the local church and meet some new people and find out they have a pedometer step challenge. You can start just exercising on your own, finding out there's local trails in your neighborhood that are safe to walk on and actually plowed in the winter and things like that, right? So when we talked to physicians, we found out that they don't know where the local physical activity opportunities are for their patients. They don't want to refer patients to programs that are not safe, which is, with my knowledge, I know that that's ridiculous, because all physical activity programs are safe, because physical activity is safer than not being physically active. So the fact that the physicians didn't know where the exercise programs that were safe were meant they just didn't know what was in their neighborhood. So Encourage was really about creating these new linkages between the clinic and the programs. And if we needed to, there was a kinesiologist involved that we could refer the patient to get some one-on-one counseling to talk about how do you develop your own action plan.